Well, good evening, coders. It is Wednesday. We're halfway through the week. How are you guys? Looking in the chat. Hi, Sarmi. Hi, Kelly. I see Tracy's here and Miss Patricia. How are you guys doing? How's your homework coming so far? You're studying. Good. See, Brittany's here. Linda. Hi, Linda. Who else do we have in here? All right. Coming along, says some of you. Good. Well, I'm doing well. Somebody asked me how I'm doing. I'm doing well. It's the middle of the week. I've got 2 days left and then a nice weekend coming up. So I'm looking forward to that. Before I go too much further, I would like to bring in my team and introduce them to you. I cannot do this without them. They are my right arms. I've got two right arms tonight. I've got Miss Josie. Miss Josie, would you say hi to our coders?
Hi, good evening, coders. Good evening, team. Miss Melissa, Miss Jeannie. I hope you're doing well today. It's a sweltering 100 degrees here in Whittier, California. That's really hot for us because we're by the beach, so we're dying over here. I don't have central air, but I'm here with you guys to study, and Miss Melissa has a great PowerPoint for you guys. I'm glad you came.
Thanks, Miss Josie. We're glad you came. And I also have Miss Jeannie here with us tonight. Miss Jeannie, you want to say hi?
Hey, coders. Miss Melissa, I was just thinking on if I had two right arms, because I'm right-handed, instead of a right and a left, how much could I get done? That would be fabulous. I wonder if that's a surgery one can have in the future. Maybe a brain surgery to make yourself so you can control two rights. Anyway, I can get a lot of coding done, I bet. Right and left hand flipping through books. So we'll try it sometime, but maybe not tonight.
All right. Well, thank you so much. I'm glad that you're here. And I see somebody is moving to Sacramento soon. I do not envy you for the packing and the moving, but I hope you enjoy your new home. All right. So we got quite a bit to do today. Today is musculoskeletal system. So let's get started. You know our drill. We have to start with our copyright. So Miss Josie is going to go over that with you.
All righty. CPT copyright 2019 of the American Medical Association. All rights are reserved. Fee schedule, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained herein. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is a copyright of AAPC. Keyword concept, FTR, Chun, AMCI, Fab 7, Flip Tap are all trademarks of AMCI.
About that. No, we have a couple of new people, so want to make sure that they're good. Everybody else has been around, so you've seen that a number of times for sure. All right, well, we'll get right into our time scenarios. Miss Josie, you want to start out reading this one for us?
I can do that. Okay, coders. We'll begin with the answers first. We have A, rods attached only at the top and the bottom of a spinal fixation device. B, bone plates in more than one area of the skull. C, a spinal fixation device attached at the end of a rod and at additional bony attachment. D, the instruments used in surgery of the metatarsals. The question is, what is segmental instrumentation? And we'll give you 2 minutes on this one. All right, coders, I see that the majority of us have it, Miss Melissa. We're a little split here, sprinkled on the infield.
I see that. I am very impressed. When I first saw this scenario, I was stumped. So I am thrilled that almost all of you got this correct. All right, so your answer, as most of you figured out, is C. Segmental instrumentation is a spinal fixation device attached to each end of a rod and at an additional bony attachment. So that's what segmental instrumentation is. I think I had if I remember correctly, it's been a little while. I think I had a question similar to this on my exam. So if you didn't know this, I might notate that somewhere in your book. All right, we'll move on to the next one. Miss Jeannie?
All righty. Let me get my little screen moved over. Okay. Our answers are A, S52.90XA. B is S52.301B. C is S52.311A. And D is M84.439A. A patient has a Greenstick fracture of the right radial shaft. It is treated surgically by placing a bone plate on the distal radial shaft. What ICD-10 CM code is reported? And we'll just do a minute and a half, and we will start now. All right, coders, that is time. Go ahead and get your answers in.
Thank you, Miss Jeannie. Man, you guys are impressing me from the start. I see most of you got this one right as well. You're doing fantastic. So let's go through this really quickly. I'll find my mouse. Where did it go? All right. So, My clicks didn't go right. Please forgive me. I thought I just fixed it, but I can still go through it without the click. All right. So our keywords are greenstick fracture, right radial shaft. Because my clicks. All right, so let's just take this code by code. So number one, if we look at M84.439, that is a pathological fracture, unspecified, ulna and radius. Well, there are two things wrong with this code. Tell me in the chat, coders, what are wrong? What's the two things wrong with this code? Why didn't you pick this one? Yes, Brittany. She said it wasn't specified. That's right. Okay. And so did Chanel and Miss Patricia. All right. And Tracy picked up on the other thing. She says pathological. Well, tell me what a pathological fracture is. Yep. Yes, Sarmi. Pathological is age-related. So this would be somebody getting older and they have osteoporosis, and because their bones are weakened, they might have been, just walking and they got a fracture, or they might have bumped their arm, because that's where we're dealing with, and it fractured because their bones were weakened. All right, so that's not what we have. So we'll get, because I don't have the clicks. So we'll get rid of D. D is incorrect. So let's look at S52.90. This one says unspecified fracture of unspecified forearm. Well, you guys have already told me that. We have a specified fracture. We know what kind of fracture we're dealing with. We also know where that fracture is. It's the right radial shaft. So S52.90, sorry, so sensitive. S52.90 is incorrect. So answer A is gone. So let's look at S52.301B. Number one, that is the wrong 7th character to be added. We don't have a B. You see this box over here? We have A, D, G, K, P, S, no B. So that's wrong right away. And also, it's unspecified fracture of the right radius shaft. So again, the unspecified is what's causing this to be incorrect. So we get down finally to our correct answer, and that's S52.311A, because it's the initial encounter. And there we have it. Greenstick fracture of shaft of radius right arm. Those are all our keywords right there. And that leads me to remind you guys to be sure to put your keywords in the chat when you give us your answers. All right, any questions on that one? I don't suspect so, since most of you got it right. But if you do, now's the time. Okay, we're gonna move on. Miss Josie, would you read this one for us?
Sure. Okay, here are your answers, coders. A is 20600, B 20612, C 20615, and D 20600, 20612, modifier 59. Which codes would you report for an aspiration and injection of a ganglion cyst to the bone of the great toe? Coders, we have your time is 2.5 minutes. Okay, coders, get your answers in. And I think we're all stumped on this one. This is one that we have to go over a few times. And we really need to chant our books, right, Miss Melissa?
Yes, ma'am. Let's see. I do see a couple, maybe one or two people got this, but I like this because I love aha moments. So let's take a look at it. All right. You know, I like to ask you to look at your answers first. And the thing that, remember I said to look for answers that share codes. And so we see that we've got A shares its code with D, and B also shares with D. So that might be something to note. Might come in handy to notice that. All right, let's look at our keywords. I saw some great keywords in the chat. Thank you so much for putting those in. It helps us to maybe help you figure out where you might be looking at it if you miss it. All right, so our first keyword, we've got aspiration. This is going to be paramount. Injection, ganglion cyst, bone, and I should have highlighted left great toe because this is where bone of the left great toe. What is aspiration and injection? Ganglion cyst. All right. So if we look at 20600, this is for arthrocentesis, aspiration and or injection, small joint or bursa. This is outbound guidance. All right, I think I had a few A's in there. Let me see. Did I have a few A's? Nope, I didn't. So tell me in the chat why you decided 20600 was wrong. Minute aspiration and or injection. Good job, Tracy. There are some forensic readers in this class. Yep. All right. So here's what you're telling me. You guys are all telling me great things. You're telling me this is a joint, not a bone. And there was no mention of arthrocentesis. All right. So those are both good reasons why not to choose this code. So right there, remember I said if we looked at our answers first, this might be helpful. Look, we're rid of 2 answers. We can get rid of A and D because we know 20600 is not the correct answer. All right, so we've just got 20612 and 20615 left to deal with. In 20612, we've got aspiration and or injection of ganglion cyst, any location. Okay, I think I had several people that chose B, but this is the wrong code. For those that didn't choose B, why? Why didn't you choose 20612? The correct answer is C, and I had a few people choose C. Why did you pass up answer B? I've kind of given you already. 20, let's look at this. Of ganglion cyst, which that's what we have, aspiration and injection of a ganglion cyst. So that seems to make sense, right? Yes, Kelly, you've got it. Yes, Elaine. All right. We have a more specific code. Remember, we need to code the highest specificity. You know what I'm trying to say. Can't say that right now. We need to code to the highest level. And 20615 codes to the highest level because we have aspiration and injection for treatment of bone cyst. Bone cyst. That is more specific than a ganglion cyst that could be anywhere. I know that it doesn't say ganglion cyst, but a cyst could be any type. It could be a ganglion cyst. And because it says bone, see, this is any location, but we know ours is the bone. Brittany asking, yeah, this one is tricky. So you're asking, it didn't specify treatment? The code doesn't specify treatment? The scenario. Yeah, the treatment is the aspiration and injection. Okay. All hearts and mind clear? I don't want to move on if that's still, if you're still unsure. Okay. This might be something that you want to go ahead and mark in your book too, just so you remember, because this one is very, I will give you guys that. It is tricky. All right, I'm going to move on. Oops, I have more clicks. All right. Is this Miss Jeannie?
Did you see my note? I was going to present this one, which I'm happy to read it as well.
Sure, certainly. Then
I
I'll
can
read it.
for her. Or okay, that's fine. Thank you.
Okay, cool. Thank you.
Okay. All right. Here are our answers. Answer A, 24535 with modifier L and 2910 with modifier L is 2453 with modifier LT. C, 24582 with modifier LT, and D is 24566 with modifier LT and 29105 with modifier LT. Here is your scenario. A patient presented with a closed displaced supracondylar fracture of the left elbow. After conscious sedation, the left upper extremity was draped and closed reduction was performed, achieving anatomical reduction of the fracture. The elbow was then prepped, and with the use of a fluoroscopic guidance, 2 K-wires were directed, crossing the fracture site and piercing the medial cortex of the left distal humerus. Stable reduction was obtained with full flexion and extension. K-wires were bent and cut at a 90-degree angle. Tefla padding and splint were applied. What CPT code or codes is or are reported? And you have 2.5 minutes. You may begin now. Oh my, I'm so sorry. The time went off and I didn't even notice it.
All right, I'll come on in here then. And coders, it is looking good in the chat, I'll tell you that. So I'll just be preaching to the choir, looks like. Let's see what we got here. Okay, so let's go through and see our keywords. So we have closed displaced, supracondylar fracture, left elbow, upper extremity, closed reduction, performed elbow, fluoroscopic guidance, wires, crossing the fracture, and piercing medial cortex, left distal humerus, stable reduction was obtained, full flexion, splint, and codes, or codes. Okay, let's see. So let's take a look at our first code, 24535. Parent code is 24530, and that is for closed treatment of supracondylar or tricondylar humeral fracture, which with or without intercondylar extension without manipulation, and then so 24535 is with manipulation, with or without skin or skeletal traction. And that sounds good, but that is not enough. That's only part of what happened. We had the closed reduction, but then we also had the fixation with the wires. So that is by itself is going to be wrong, because that other code, the 29105, as you can see right here, that is the splint. So, and typically the splint is going to be bundled with repairs of fractures. So a treatment of the closed treatment of the supracondylar fracture and the splint, that is not enough. That's not all of what happened, and the splint is actually going to be bundled. So let's take a look at our next one, which is 24582, and that is the answer for C, and that is percutaneous skeletal fixation of humeral condylar fracture. So we have a supracondylar fracture. So that is going to be incorrect. That's the wrong location. And then our code there for D, 24566, is humeral epicondylar fracture. So again, that is not the correct location. So that one is not going to be correct. And then they're also coding for that splint. Oops. Oh, darn it. My clicks got off, and I kept pressing it and it jumped ahead a bunch. There we go. Okay. Let me try this again. Okay, so that's why D is incorrect. And then obviously B is going to be our answer, and that is percutaneous skeletal fixation of supracondylar humeral fracture. So that is what we are looking for, and that is going to make B our correct answer. How'd y'all feel about that one, coders? Looks like everybody pretty much got it right. So I think y'all were.
Can I jump in here?
Sure.
One quick tip I wanted to give is that we could have eliminated two answers right away. We could have eliminated A and D if you had remembered that casts are or splints are bundled. And what I did on the pages where we're dealing with fracture and or location, I just wrote down in the middle where I could find a space. I wrote the code 29105 cast bundled. That way, if I'm looking at 24538, 24566, if I'm looking at any of those codes, I already know, oh, shoo, that has a 29105. I don't need it. So there's just my tip and trick.
Pretty smart. All right, and I think that is it for this scenario.
All right. I'm going to begin with the answers first. A is 20696, B 20697, C 20694, and D 20692, 20697. A 44-year-old male with biplanar deformity, acquired limb length discrepancies, and a tibial non-union has undergone deformity correction. He now requires exchange of an external fixation strut 45 days postoperatively. One of the struts for his multiplane external fixation device is removed and then replaced with an adjustable strut. The intraoperative mounting parameters, deformity parameters, and initial strut settings are entered into the computer prior to Jim's discharge, and a daily schedule is generated for him to perform the gradual deformity correction necessary. What CPT coder codes are reported. Coders, we'll go ahead and give you 2.5 minutes on this one again. Thank you. Okay, coders, get your answers in. Okay, I see we're a little bit split on this one. Miss Melissa, we're between A's and B's.
All right, great job. I'm going to pass it on over to Miss Jeannie.
Okay. Let's see how we do this one. Okay. So let's take a look at our keywords first. We have 44-year-old, biplanar deformity, acquired limb length discrepancies, tibial non-union, deformity correction, exchange, external fixation strut 45 days postoperatively, one of struts, multiplane external fixation, removed, replaced, adjustable strut, intraoperative, mounting parameters, deformity parameters, initial strut settings, entered into the computer, daily schedule, gradual deformity correction. Okay, and just a note here that we see the arrow to one of our codes, 20697, and it has a parenthetical note to do not report that code in conjunction with 20692 and 20696. So we can actually go ahead and cross out D, because as you'll see, they coded 20697 with 20692, and that's one of the codes that you're not supposed to use it with. So that, I always like it when things are a little bit easy like that, and you can already mark through an answer. So let's see what else. For code 20694, that is for removal under anesthesia of external fixation system. So we didn't have any mention of anesthesia, and that one is coding for just the removal. So, and that is not what we had. We had, as you remember, we had removed and replaced in our keywords. So that one's removal only. So that is not going to be right. Then next, the code for A, 20696, that is application of multiplane, and that includes imaging, initial and subsequent alignment, assessment, computations, or adjustment schedule. And that's not correct, because that is the wrong procedure. He already had it put on, and this is for the application of the device. And that is not what we're doing here. Again, we had a removal of the device that was already on, and then replacing it with another part to the device. So our code that we're left with is B20697, and that is exchange. So the parent code is that 20696, the application, and then now we have a little more detail here with this one, saying that it's the exchange, i.e. removal and replacement of strut. And so for each one, you would code this 20697. So from our keywords, we had one strut removed and then replaced with an adjustable strut. So that will make B our correct answer. That is exactly what happened in our scenario. So how do y'all feel about that one, coders?
So it looks like I've
Check my
got a
chat
couple
here.
of goods going on, so you feel good about that.
Good. I was seeing lots of B's in the chat there at the end, so hopefully that all made sense.
Yeah, it looks like it. Looks like most everybody got that correct. All right, well, we will move on to our next scenario. Right, Miss Jeannie, I'm sorry you just explained one, but would you mind reading this one?
I wouldn't mind at all. I love reading.
Okay, thank you.
Okay, so our answers are A, 20610 with modifier RT, J, 3301 times 4, B is 27093 with modifier RT, and J, 3301 times 1, C, 20550 with modifier RT, and J, 3301 times 4, and D is 20611 with modifier RT, and J, 3301 times 1. A 42-year-old with chronic right trochanteric bursitis is scheduled to receive an injection at the pain clinic. A 22-gauge spinal needle is introduced into the trochanteric bursa, and a total volume of 8 cc's of normal saline and 40 milligrams of Kenalog is injected. What are the CPT codes? And we'll do 2.5 minutes, beginning now. That is time. So if you can go ahead and get your answers in, we'll go over it.
Wow, sometimes that time seems to go by so quickly. All right. It looks like we have, looks like maybe 100%. Amazing, coders. I'm stoked about that. All right, so we won't have to spend too much time on this one. But the first thing I want to ask you is, what did you notice about your answers? If you're looking at your answers first, like I preach over and over, what did you notice? Right. Somebody says modifiers. I'm guessing you mean the times. Well, the modifiers, right? Yes, RT. Yeah, they're all the same. Very similar diagnosis. Yeah. The J code. Yes, J code. They're all the same except for how many times. So I see that we have two that is coding for 4 times and 2 that is coding for 1. So I'm going to pay attention to that when I look at my keywords, because I will be able to eliminate 2 answers right away. All right, so let's look at our keywords. Our answer is, in fact, A, like I think all of you answered. And our keywords are 42-year-old that has chronic right trochanteric bursitis. That's our what? Our diagnosis. Injection, that's our second what. This is our procedure. And how they did the procedure was with a spinal needle introduced into the trochanteric bursa, and they insert 40 milligrams of Kenalog. That was what was injected. Okay, so I've been doing this quite a while, so I know normally the 2 options that we have for Kenalog is either 1 milligram or 10 milligrams. So since I know that, and you might not have known that, if you didn't know that, you would have to look it up. But since I do know that, I know that if I need 4 times, I'm going to have the times 4. So I can get rid of B and D. But let's look at it. If you had to look it up, if we look at B, it's 27093. It says injection procedure for hip arthrography without anesthesia. That is way off in the left field. We didn't have that. We didn't have a hip arthrography at all in our scenario. So we can get rid of that one. And then D is 20611. This is arthrocentesis, aspiration, and or injection, major joint or bursa. And this is of the shoulder, hip, knee, subacromial bursa, and this is without ultrasound guidance. So that is our parent term, our parent code for our code 20611, which is in answer D. And the reason why this one is wrong is because okay, this is not right. The ultrasound, just get rid of that. I'm sorry. We need 10 milligrams of Kenalog. That's why this one is wrong. We only have, we need 40 and we only have 10. So 20611 is wrong because we need 40. And I see now why I have this. It sets with ultrasound guidance, and our scenario did not have ultrasound guidance. So we can't code for that. So that leaves us with 20610-050. So 20550, this is injection, single tendon sheath or ligament aponeurosis. Well, this is in the wrong spot. That's not what we did. That's the wrong location. So we did like 20610. It is correct. We had the arthrocentesis, aspiration, and or injection. And that's what we had, injection. Major joint or bursa, we're in the trochanteric bursa. So that's what we wanted. And this is without ultrasound guidance. We didn't see anything in here that has ultrasound guidance in it. So A is correct. But let's just look over here at our J code. J3301 says injection triamcinolone acid. Oh, that's a mouthful. I'm so glad we don't have to say all that. Not otherwise specified, 10 milligrams. And this is Kenalog right here. It's known also by all of these names, but Kenalog is what we were looking for. Like I said, 10 milligrams. So we need times 4. How do you think about that scenario? Any questions? Okay, good. All right, we'll move on. And Miss Josie, would you mind reading this one?
Sure. We'll start with the answers first. Coders A 0232T, B is 20551, C 20551-77002, D 0232T 20551-77002. A patient suffering from a non-healing knee tendon underwent a platelet-rich plasma injection under imaging guidance. How should you report this procedure? Coders, we can do 2.5 minutes on this one. Coders, I apologize. I forgot to set the clock.
No worries. It looks like that gave a couple of people to eke in their answers. All right. You guys are doing excellent. Excellent tonight. I realized I stacked the deck with injection scenarios, and you guys all have a handle on these injections, so I might have to put these aside for our next several musculoskeletal sessions. All right. So tell me about your answers here. Were you able, just by looking, were you able to eliminate any codes at all? I'm not saying that that was needed. I'm just asking. Okay. A couple of you are saying D for sure. Okay. Yay. Okay. Well, without looking at your codes, would you be able to for sure eliminate D? Okay. Yeah, not by looking. So you wouldn't really, just by looking at these answers, you wouldn't be able to eliminate anything for positive, but a couple that I know or that I see 7 codes that start in 7-7. Usually this is some kind of image guidance, imaging kind of thing. So I might look for that in my scenario. And then I see that we're using category 3 codes here. So coders, tell me a little bit about category 3 codes. What do we know about category 3 codes? Patricia, you're on the right path. Okay, so what she said is, I've never seen a temp code with regular codes, and there is a reason for that. Temporary codes are there because these particular procedures, category 3 codes, they're particular procedures that have been taking place over the last several years that we've seen an uptick that physicians were using unspecified codes. So they've gone in and done some research and said, oh, well, we're seeing that this is taking place. Maybe we need to make a specific code for that. So that's why we have our temporary codes. And most likely you're not going to use a temporary code and a permanent code. So there you have it. That would be why. And in this case, that's exactly what happened. We don't use temporary codes with the permanent code in the scenario. So let's look at it. Our keywords are patient, non-healing knee tendon, platelet-rich plasma injection, imaging guidance. Okay, right there, without looking at the codes, I might think, oh, okay, there was imaging guidance, and I see I have some imaging guidance codes. If I chose one of these just based on that, I would be sorely wrong, as you guys found out. Okay, so let's look at it. If we looked at our parent code, so our code that we're looking for is 20551, but we need to look at our parent code. It says injections, single tendon sheath or ligament aponeurosis. Okay, but our code right here says single tendon origin insertion. All right, so far, pretty good. But if we look at our parenthetical guidelines, parenthetical guidelines, and somebody said this in the chat, way to go. They noticed right away that it says do not report 20550 or 20551 in conjunction with 0232T. So that would get rid of D right away. But if they kept reading, says for harvesting, preparation, and injections of platelet-rich plasma. That's what we had, right? We had platelet-rich plasma. It tells us exactly what to use. Use 0232T. There's our answer. It gave it to us right away. But because we're forensic coders, we're going to double check, right? So 0232T says injections, platelet-rich plasma, any site, including imaging guidance, harvesting and preparation when performed. So like I said, if I would have jumped the gun thinking, oh, I need imaging guidance, I need that code, I would be sorely mistaken, because here are, oh, I didn't have it highlighted. Our parenthetical guideline here says, look, don't report with 77002. So parenthetical guidelines are key here on this one. We could have been done with this one in probably 30 or 45 seconds, wouldn't you say? Any questions? All right. Nobody's got any questions. All right, so we'll move on. Miss Jeannie, will you read this one?
Alrighty. Our answers are A, 20552, B, 20553, C, 20610, D, 20553 times 3. A 39-year-old involved in a motor vehicle accident a year ago arrives to the pain clinic with complaints of neck pain and left-sided radiculopathy complicated by cervical degenerative disc disease. NSAIDs and physical therapy have been unsuccessful, and the patient requires multiple trigger point injections. The left multifidus, trapezius, and right levator scapular were injected. The area was cleansed and bandage applied. Which procedure code or codes best describes this encounter? And we'll start with 2.5 minutes beginning now. Okay, coders, that is time. Get your answers on in.
Thank you, Miss Jeannie. Let's just take a look and see what you all told me. Okay, I see a couple of different answers. I think somebody chose at least one person chose one of every answer. So we've got some A's, some B's, some C's, and some D's. So I'm looking forward to sharing this one. Sorry, I had a little cough. All right. Is there anything to note about our answers? Nobody noticed anything? Ah, C is in a different area. That's a good observation. And B and D are the same code, just times 3, right? Yep, that's what Brittany said. C is an oddball. Yep. All right. See, these are good things to pay attention to when you're looking. All right, let's look at our keywords. Well, let me tell you the correct answer first. The correct answer is B. And our keywords are a 39-year-old was in a motor vehicle accident, or MVA. I should have marked this a year ago because I think that's somewhat important, because she didn't have the motor vehicle accident today. So note those kinds of things. Arrives to the pain clinic with complaints of neck pain. That would be our diagnosis, or what? And left-sided radiculopathy. That's also our diagnosis. This is complicated by cervical degenerative disc disease, another diagnosis. So she requires multiple trigger point injections. That's another what? This is our procedure what? And these are to the left, multifidus, trapezius, and right levator scapular were injected. All right, so multiple trigger point injections. So if we look at 20552, it says injections, single or multiple trigger points, 1 or 2 muscles. I'm liking that, but not completely. 20552, how many muscles did we have? Yep, we had 3. We had 3. So 20552 is not enough. My clicks seem to be out of order, so let's look at 20610. This says arthrocentesis, aspiration, and or injection, major joint or bursa. This is the oddball you guys were telling me about. It does say injection, but it's to major joint or bursa. And it does say, nope, I'm not even going to say that. This is not what we had. We had trigger point injections, not joint or bursa. So as you guys said, it is an oddball and it is out of there. So let's go back up to this 20552. So I said I liked it, but we don't like it because there's not enough muscles. We had 3. So 20552 is gone, leaving us to just decide between B and D. And the only difference is, do we code once or do we code 3 times? I mean, we had 3 muscles. Why don't we code Why don't we code D? Yep. The verbiage of the code says 3 or more muscles. And the parent code says injections. I liked to highlight that with like an orange or yellow or pink, just the S there to remind me that this could be used for one or multiples. And we did have 3 or more muscles. We had 3. So we don't need to code times 3. That would be upcoding and we would be in big trouble. So answer B is our correct answer, 20553. That's right, Angelique. You count the muscles, not the units. So we don't know how many trigger point injections they did. I mean, it just says multiple, but they did it to 3 muscles. And that's what our code language says. You count the muscles, not the injections. Right? Any questions? Several people did not get this one right because you guys were all over the place, sprinkling the outfield. Do you understand why you got it wrong now? I know you did, Miss Patricia. Good, Lavon. Good, Tracy. Okay, we will move on then. All right, is this you, Miss Josie?
That's me. Okay, coders, here are your answers. A, 20552. B, 20610 times 6. C, 20552 times 5. And D, 20553. Patient complains of chronic acute arm and shoulder pain following bilateral carpal tunnel surgery. Patient is followed by pain management for over a year. Physician finally diagnoses patients with reflex dystrophy syndrome, RSD. Physician performs 6 trigger point injections into 4 muscle groups. Code the procedures. We'll start out with 2.5 minutes, coders. Oh, you guys are on that one. Great job, coders.
They did excellent, and I can tell that they listened last time because this one is almost exactly like the last scenario. All right, so let's look at it. We've got arm, shoulder pain. This was following bilateral carpal tunnel surgery. Physician diagnosed patient with reflex dystrophy. So then he performed 6 trigger point injections into 4 muscle groups. Okay, so we basically looked at this one already. We looked at arthrocentesis, and that's not what we want. We are doing injections. Injections into how many muscle groups? 4. We have 4 muscle groups. So 20, excuse me, 55 is not enough. So we got rid of A, and we got rid of C because we can't do 20552 times 5. This is for 1 or 2 muscles, period, because of this single or multiple trigger points, 3 or more muscles. This could be 6 muscles. This could be 8 muscles. 3 or more muscles, so we can't multiply 20552. So D is our answer. 20553, end of story. That covers our 4 muscles groups, and that covers the 6 injections. All right, I don't think I have to spend too much more time on that one because you guys all got it correct because you were listening. I tricked you a little bit, didn't I? All right, we'll move on. All right, Miss Jeannie, if you'll read this one.
Okay, our answers are A, 20680 with modifier LT. B is 20680 with modifier LT, and 20680 with modifier 59 and modifier LT. C is 20670 with modifier LT, and D is 20680 with modifier LT, and 20670 with modifier 59 and modifier LT. A patient presents with a healed fracture of the left ankle. The patient was placed on the OR table in supine position. After satisfactory induction of general anesthesia, the patient's left ankle was prepped and draped. A small incision about 1 centimeter long was made in the previous incision. The lower screws were removed. Another small incision was made just lateral about 1 centimeter long. The upper screws were removed from the plate. Both wounds were thoroughly irrigated with copious amounts of antibiotic saline solution. Skin was closed in a layered fashion and sterile dressing applied. What CPT code or codes should be reported? And our 2.5 minutes begins now. All right, coders, that is time. And seeing some mixed answers here in the chat, so hopefully this one will be a good learning scenario.
Great. Thank you, Miss Jeannie. Let's look at what we've got in the chat. I see a mix. I see you guys are liking answer B and answer A mostly, I think. So talk to me about our answers. Tell me what you used off the bat. And eliminate D just by looking at it. Without looking at your codes, you can eliminate D. Is that what you're telling me? Modifiers. Yep. Tell me about modifier 59. What do we use that for? Something has happened to my chat. Give me just 1 second. My chat has gone haywire. I can't see what you guys are saying. I don't like that. All right. Oh, I fixed it.
Okay, I was going to say they're saying separate procedure, different procedure, distinct procedure.
Perfect. That's exactly what modifier 59 is. It's a separate or distinct procedure. Different body area, totally different procedure. I'm actually going to read a little bit about 59. It's used to identify procedure services other than EM services that are not normally reported together but are appropriate under the circumstances. Documentation must support a different session, different procedure or surgery, different site or organ system, separate incision, excision, separate lesion, or separate injury. So we're looking, and it goes on, but this is, I mean, totally separate. Okay, so we want to keep that in mind when we read our scenario. I'm having trouble with a pair on this particular modifier right now. I don't like it. All right. So our codes, our keywords are healed fracture, left ankle, supine position, again ankle, small incision, lower screws removed, upper screws removed from the plate. Okay, so did we have, is this in a different body area? Is this a separate procedure, separate surgery? Or is this, I mean, it's a similar body area, right? Yep. Yep. So modifier 59 is not going to fly here, and they will take you to the cleaners on that. Okay, so we cannot use modifier 59. So we'll be able to get rid of B and D. But I will go through the codes. The other thing I noticed about our answers here is we're only dealing with 2 codes as well. We've only got 20680 and 20670. So let's look at what's different about them. That's how I would attack this. I probably would have turned right to these codes really quick before I even read this to see what was different. Then I could have pretty much eliminated my answers. So 20670 says removal of implant, superficial. This would be a buried wire, pin, or rod. Okay. That's right. It is superficial. So this is incorrect. 20680 is deep. It's the same removal of implant but this is deep. So tell me, I've already told you that the superficial one is wrong. Tell me why. What in our scenario indicates that we want deep rather than superficial? No, incision wouldn't necessarily mean that's deep. 1 centimeter. Layered is a good guess. Okay. What I'll show you. Oh, I thought it showed you. Okay. So because we had to go all the way to the incision to get to those screws. I mean, this is why you have to read forensically. The incision to get to those screws that were in the left ankle bone, that's going to be deep. A small incision. So the 1 centimeter is just long. That's not how deep he went. All right. Does that make sense? And these are buried wire, pin, screw, metal, rod, or plate. And we were looking for the screw. This one just says buried wire, pin, or rod. Yeah, Miss Patricia, you saw the screws. Way to go. Okay. Oh my goodness. I have kept you guys up. Man, the time went by so fast. I thought we still had time for one more, but we don't. It is 9:05. So thank you guys so much. You guys did fantastic. We had a lot of injection scenarios this time, and you guys did famously with those. So I'll probably put those aside for a little bit, and we'll work on others next month. All right, any questions before we head out? And team, you can go ahead and come in and say your good nights.
Coders, you guys were amazing. You guys are getting better and better every week, and I like seeing your progress. It keeps me hopeful, and some of these are a little tricky, but you guys did well. Have a good evening.
Hey, coders, y'all did really good tonight. Lots of scenarios we went through, and some were pretty tough, but you know, y'all asked really good questions, and you have really got a good handle on things. Hopefully, we will see you on Friday.
All right. Yep. If you have gotten through the section on the respiratory, if you've seen those videos and done your homework, we want you in our Friday class if you can make it. And thank you so much, Tracy and Angelique, for your kind words. And we will see you on Friday. Have a great one.